I'm here with Dr. Bill Clearfield. We just got done with conference here in Miami, Florida at the Doral, Trump International Doral.
There's always tips to pick up. There's always something new. Measuring inflammation. We do it all the time in our office, but it actually became very crystal clear when Dr. Carmen, the cardiologist, was going over, and he said that the calcium score was pretty useless.
Yeah.
And that's pretty almost standard now.
Yeah.
And he was talking about doing a CT angiogram and catheterization.
Yeah.
And I didn't get a chance to ask my question, but my question was, well, what do we people out here, as lay people out in the boondocks do?
You know what I do? I have the Butterfly IQ. Hooks up to an iPad. I look at people's carotids.
Yeah, I have it too, actually. Way back, you don't know this, but I was an OBGYN resident back in the late 70s, the dark ages, and we had just gotten our first ultrasound machine at the hospital. It was on a wood slab, and it took Polaroid pictures. It looked like, I didn't know what it was. It looked like snow. So we do 4 tests. I mentioned them in my talk.
You did, yeah.
So we do C-reactive protein, we do homocysteine, LPPLA, and myeloperoxidase. That's not the last 2 are not really part of our regular routines. C-reactive protein. What we're looking for is a change, really. So even if it's normal, normal's less than 3. If it's 0.8 and it goes to 1.4, that's actually a significant change in inflammation. Homocysteine, normal is less than 11. Our goal is less than 10. Anything over 15 is a heart issue unless you prove otherwise.
Yeah.
And LPPLA is indicative of a plaque vulnerability, so cholesterol plaques. Yeah. And then MPO is the plaques ruptured, so that's much more serious. But you can get an idea of what's going on with those 4 things. The guy showed up and his homocysteine was 33, and I sent him right over to the cardiologist, who called me and told me I was an idiot. And then the guy was in the ER 6 days later, having a full-blown MI with a 99% lesion. So
wow.
Hey.
What do you use to stabilize plaques? Vitamin E, statins. What do
vitamin E, aged garlic. Vitamin E, pomegranate seed, omega-3s. Yeah, I mean, if their cholesterol is really high, statins, but I rarely prescribe them.
Rosuvastatin, I like that one a bit better.
If I prescribe 5 statins a year, that's a lot.
Yeah.
And I've been pretty much only using the rosuvastatin, Crestor.
Yeah, Crestor.
It's the lowest dose, and it really seems to have the least side effects.
It does, yeah.
So I usually only give 5 milligrams.
Might actually lower CRP too.
Yeah. Dr. Carazola, I don't know what you can say about that guy. This was the second time I've heard him talk about using oral estradiol. We've always been taught never.
Yeah.
He takes 7 milligrams. He's down. He was 8 last year. He was taking 8. Now he's down to 7 milligrams of estradiol a day. His testosterone levels he used really high doses. He gets pellets. I don't remember what he said, but his level was 1975.
Okay.
His estradiol level was 175. I don't know. My patients don't. Our cutoff was always 40. Usually the patients, if they're always complaining of stuff, poor libido, breast tenderness, emotional issues and whatnot. You get their estrogens down to 30, and they're a lot better. So I don't agree with that at all. They also talk about not using an astrazole as an estrogen blocker. I don't know. It's cheap. It's a tiny dose. Usually a half milligram to a milligram a week.
Yeah.
I don't see that there's an issue with it. You get 30 of them at Costco for $13.
I know.
So, you're going to start using a whole bunch of supplements. It's going to cost them $100 a month for that.
Yeah.
And I mean, they talk about, you're blocking estrogen down to 0. Now, when we first started, we did that. So I don't know if you know that. When we first started 20 years ago, we would get the guy's testosterone levels to 1,500
Oh, wow.
and give him estradiol or anastrozole or what's the other one?
Exemestane, you can do aromacin.
Aromacin.
Yeah.
That one, we would get their estrogen down to 0.
Wow.
I mean, just out of habit that we would do that. So we don't do that anymore. We kind of realized. So I usually shoot for about 700 to 900. That's usually they get pretty much all of the benefits there. Usually anything over 900, I don't see any more benefit. And but you need to keep the estrogens. 15 to 25 seems to be the sweet spot. 30 is okay.
Yeah.
If it goes over 30, if it's less than 40, I'll use some of the herbal remedies. We'll use saw palmetto, we'll use chrysin.
Well, saw palmetto works for estrogen?
Yeah.
I thought it was DHT.
It does. It
Oh,
works
that's
for both.
cool. I'll use calcium D-glucarate, a bit of DIM.
Yeah.
Those are good for reducing estrogen.
Yeah. But we use one of those, and we don't let it go down to less than 10. So.
Yeah, they'll get their joints will dry up.
Yeah, and they'll start having memory issues too.
Memory issues, yeah, pain, and then apparently cardiovascular risk if you crush estrogen too much.
Yeah, the gal who did with the genetics, I quite frankly I don't understand the genetics. They'll do a whole one, but they'll tell you they have supplements they're trying to sell you. So they kind of use their own supplements.
And speaking of supplements, you like the Arterosil and the
yeah, we've used that.
Yeah.
We've used that. It's a little hard to measure whether it's doing any good.
Right. You hope it's doing something, right? It's supposed to replenish your glycocalyx of your arterial walls.
It's kind of hard. I mean, it's kind of hard to measure that. But we did have this. This was about 2 weeks ago. I got a call on a Monday. One of our patients had a heart attack on the Friday night before, acute MI, and then he was he had been in the hospital, and he went to the hospital. They distended him, and he was home by Monday. And I remember I remarked to my secretary, and I said, when I was in regular general practice back home in Wilkes-Barre, we would have 2-3 heart attacks a week. She's been with me for 8 years. I said, how many patients have we had that had heart attacks? She goes, that's the only one I can think of. I said,
wow.
We've had almost none. I mean, this was the first one I think I've had in years.
That's good.
I mean, we had one guy who was kind of a wild guy. I think he got COVID and he ended up dying. But, he's one of these guys that used to go to Thailand to go chase 12-year-old girls. Had lots of diseases. So I don't know if that one counted. And another guy OD'd on drugs in L.A. So
yeah,
I don't know if I can take responsibility for that one either. But that's about it. I mean, you do this kind of work. You probably see the same thing. I mean, your patients.
Yeah, they're pretty healthy.
Now I had decidedly a more elderly, sedate population, in Pennsylvania, but still, even here, I mean, I have a lot of patients in their 60s, 70s, 80s. They don't get heart attacks. The other thing I noticed is breast cancer. I mean, we're supposed to see what, 10, 15 a year, depending on your caseload. I think I've had 3 in 10 years that I've been in Reno.
Wow.
That I can think of. So, and it's got to be the hormones, because that's our emphasis.
The nutrients.
Yeah,
the iodine, as you mentioned.
Yeah, it's got to be that.
The selenium.
Yeah. So when we do selenium and iodine combos, we do for the iodine we do a micro doses with a homeopathic dose. The RDA is 12.5 milligrams. We use 150 to 225 micrograms, just enough to kind of kickstart, keep it good.
What do you think about using higher doses like what Dr. Brownstein recommends?
You're going to end up with hyperthyroidism.
Yeah.
There. So I don't. So, but that's what we use. And most of the good supplement companies, the ones that we use, that's the way they come anyway.
Yeah, they do. I'm trying to kickstart my thyroid, and my TSH went up to 5, my T3 to 2.4.
What were you taking?
I'm taking nothing. So now I'm taking iodine. I'm taking Brownstein's protocol, about 2,000 micrograms a day, trying to reverse this thing.
Yeah. on the other side of the coin, I had a lady came in. She goes, I heard lemon balm would be good for me, and it dropped her thyroid. You know, went way down. So lemon balm will kill your thyroid. So that's one of the things we actually recommend now if they're sort of slightly hyperthyroid. We don't need medication.
Dr. Campbell's not coming to the dinner with us?
No, he said his wife.
Man, I was going to grill him because I started taking Sporanox, right?
Yeah.
And my CRP went up to 20. I never seen that before. And my oxidized LDL went up so high, 400. I couldn't believe it. And that was when my TSH was the worst.
Why were you taking Sporanox?
I have a fungal infection.
What?
I have mold.
Oh, you do?
Mycotoxins and a fungus.
Funny, you don't look like you have mold.
No, I got a fungus somewhere you don't want to know.
Yeah?
I don't know. I wonder if there's like a
He says you
detox
could use it for 6 months.
Yeah, I did a month of it. I was like,
So
but that was only 2 days and my CRP went to 20. What else do you talk about? Like telomeres. You measure telomeres?
No.
No, I don't do that either.
No, I don't do telomeres. I always feel like I'm missing stuff. You know, they talk about this stuff like I'm like behind, right?
It's just too expensive. Try out. I bought the growth hormone supplement. I'm gonna try that out.
Oh, that's what it was. It was $169.
No, it was more. It was like 200. I had a very interesting take on why men get less rates of osteoporosis than women, and it's because men retain their estrogen throughout their life and women don't. Right? We'll still aromatize some estrogen. Even at age 70, women have no estrogen.
Right.
And that's why they get osteoporosis, and then men really don't.
Unless you live in Wilkes-Barre, PA, then they all do.
What?
I don't. You know, there's no sun. It's damp. It's cold. It's
Wilkes-Barre. Oh, yeah, it is.
You know,
I applied to PA.
I lived there for 30 years.
Really?
Yeah, that's where.
In Wilkes-Barre, huh? I know exactly because I applied to PA school there once. I didn't get in, but it was a historic looking town.
Scranton.
Yeah. So you apply some Chinese medicine in practice?
You know what? I use it as an adjunct now.
Yeah.
I did use it as a primary for a while, and now I use it kind of as an add-on. So we'll do the ear acupuncture a lot, especially for acute problems. We'll use the allergy things. I have a few people come in just for that. Not too many. It's really good for emotional issues, anxiety, depression. It works really nicely. We'll use it again for there's certain techniques I have for strains, sprains, those kinds of things. It works pretty well. Long-term things. I mean, there's protocols for diabetes and things like that, but you got to do it all the time, obviously. And so it's I know there are acupuncturists that do it, and if somebody comes in, they want that. I just send them up to one of them.
Yeah.
But if somebody comes in and they have a headache, we do the ear acupuncture. Works like a charm.
Yeah.
95% of the time they go home with no headache.
You learned this in osteopath school?
No, I went to UCLA for has an acupuncture course for physicians.
Oh, okay.
We've been testing for molds. Dr. Campbell's thing.
Yeah.
I haven't missed yet. Every mold test I've sent for has been positive.
Everyone's full of mold.
Yeah, probably.
Even Reno, Nevada. You'd think it'd be drier there.
You would think.
It's not.
It was certain. So the first one was a lady who had all the crazy symptoms that you get. Did you have those? You said you had one.
No, I got a fungus on my ass. It won't go away.
Yeah. So all the brain fog, and she was overweight, and she had a lot of yeast infections and whatnot, and everybody gave her this and that. They give them a lot of. She had sinus issues and all the typical stuff, and then they keep giving them antibiotics, and it just makes it worse.
Yeah, of course. Oh, yeah, it gets worse every time.
So I gave her. I made her a fungal nose spray.
Voriconazole?
Yeah. Itraconazole and with a steroid in it.
Oh, nice.
And it cleared up, and then she was okay, and then she came back. The next summer she came back. It was back, so we treated her again, and kind of lingered, and then when the weather changed, it went away. You need to get your air it was in the car air conditioner.
Oh, car air conditioner?
That's where it was.
Oh, no. At our office, we have a microscope, and we'll put the Q-tips up the nose,
Mm-hmm.
swipe it on the dish, and take a look. And everybody has a fungus. Everybody.
Where'd you do all your training?
Yeah.
PAs in Wilkes-Barre aren't on their own doing functional medicine.
No, I mean, my parents raised me holistically. I never had an antibiotic. I never got a vaccine. Chinese medicine was common in our household. Yeah, my parents learned that stuff. German homeopathy.
Mm-hmm.
That's the stuff we did. Nutrition was the cure for everything.
We didn't. My parents didn't know anything about that. My father lived to 95. I think if he ate a piece of lettuce, that would have killed him. He was so full of preservatives. That's what. Well, that and going to the casino.
Wow, that's full of smoke in there.
When he moved, yeah, I know.
I can't
When he
stand
moved,
it.
when he came to Reno, he went every single day, and no lie, I'm not exaggerating. And that's what killed him. He couldn't, when the shutdown came. They'll never open again. It's worse than Pearl Harbor.
Oh wow.
Yeah.
Yeah, he didn't want to. I guess he had nowhere to live. He was gambling.
Yeah.
Oh wow.
So
Wow.
he was in a not assisted living. They can come and go, but there's somebody there watching him because he had broken his hip. He was a diabetic for 400 years, and a good day his blood sugar was 240. Every doctor wanted to give him insulin, but he wouldn't take it because it was made from pigs. What'd you have for breakfast, Dad? Bacon and eggs. It's made from pigs, It is.
Hey, that's keto.
So, yeah. So he it was a Sunday. It was in August. I get a call. I was actually giving a talk someplace. I get a call. Your father's in the ER. He broke his hip. He fell and broke his hip. So I go there. I go down there. What happened? It's 95 degrees outside. Even though it's not humid, it's hot.
That's hot,
right? He didn't eat that morning because he liked the oatmeal at the casino, Grand Sierra, which was the oatmeal, Quaker Oats in a package. With put water in it, but it's $9 in the casino.
Oh, it's too expensive. He's not going to buy that.
He's wearing a ski coat because he's cold all the time, and it's 95 degrees out, and he passed out and broke his hip. So, and he sailed through that. He just,
he got through it.
Oh yeah. He says, so it was during the shutdown. So he saw in the newspaper the casino was opening on a Friday. It was Memorial Day weekend. They closed in March, right? And it was the end of May. They were opening on Friday, Memorial Day weekend. So he calls. I get a call from a cab driver. He's 95 years old, my father. You got a call from the cab driver. I got your father with me. He made me take him to the Grand Sierra, the casino. He says, I told him they weren't open yet. He didn't believe me. So then he found out that the Hard Rock in Sacramento had opened. That's 2.5 hours away. And I talked to the people where he was living. They said, well, they have to put him, if he goes there, they have to put him in quarantine for 2 weeks. So Mr. Archie Bunker, stand-up guy that he was, World War II veteran. And I told him that. You know what he said?
What?
He said, don't tell him.
Yeah, that's right.
There's 80 people in this place. I said, you're going to go there. And he was like the eye of a hurricane, my father. Nothing would have happened to him. He would have brought the virus back and 10 people would have died. And whose fault it would have been. Right?
Yeah.
So I told him I wasn't going to take him. He says, okay, that's it. That's fine. He lay down on his bed, pulled the sheet over his head, and said, that's it, I'm done. And he wouldn't eat or drink anything.
Oh, wow.
5 days later, he was gone.
Wow.
And then 2 days after he died, they opened. The casino's open. I said, they're opening. No, they're not. So, but he was 95. He was a character.
He sounds like a character.
Yeah. So